How do you choose your therapist? So I will be talking about directive therapist. You have to understand, when you choose a directive therapist, they will focus on few aspects of why are you feeling such an emotion, what all you have gone through, understanding your past, understanding your traumas, and also ensure that whatever you have gone through, how are you interpreting it? That interpretation is very important. So mostly directive therapist navigates the session and do not let the counselee take over the session because they know that where is the trajectory going to be. What you need to remember is that when you choose a directive therapist, because there is a lot of perspective which is getting exchanged and shared, and diagnosis is getting shared, their observations are getting shared, you need to remember one thing, that do not use directive therapist inputs and insight to gaslight your partner or your family member, number one, because there is a high amount of transparency a directive therapist would maintain. So please do not use their statements to gaslight somebody else. And they also ensure transparency among the discussions, whatever happen. Second thing you need to remember, that therapy sessions are not bitching sessions. They are not like you are ranting against your family member and you're bitching about your family member, but you are trying to understand that what you are doing, how you are behaving and how they are behaving, where is the healthy balance, who is making more error in judgments or behavior or conduct, and who's kind of trying to focus on finding solutions. Third important thing is that therapists are not lawyers. Please understand that lawyers will look at the facts of events, the data, and you have to prove it. But when you talk to a psychologist, a directive psychologist, they are going to focus on the facts of the emotions. How were you feeling? What were you feeling? Why did you do that? Why did you say that? And henceforth. So you have to understand that a directive therapist is not going to just validate whatever you are going through. They are also going to question your belief system if you are thinking rational, if your interpretations are right or not. And one very important thing which I have learned is that a lot of therapists who enable the bad behavior in their counselees. This is another topic I understand and discussion to have or a debate to have, but you need to remember that when you go to an expert, you are going to an expert because there is a problem and there is something which is bothering you and you have not been able to address it. Now, therapist is not going to fix your issues for sure. The therapist's job is to give you perspective, and the most important thing is they are supposed to psychoeducate you. And if your therapist is just sitting quiet and not making you understand or psychoeducating you about the consequences of the actions and behavior you are taking, then there is something wrong with the therapy session. So psychoeducation is a very important part in a therapy session. CBT, which is challenging the belief system, the interpretations, the rational interpretations of the counselees, is very, very important in therapy sessions. So please ensure that you grow for a better version when you come in therapy, not to become a worst version or a lazy version or a comfortable version of yourself. My good wishes to all. God bless. I hope you learned something out of this.